So again, for those of you who don't know, and most of you probably don't, I just had a set of twins. So I do have some of my own pictures scattered throughout this little presentation. Okay, so the baby is here. So some of you might be early in pregnancy, you might be towards the end, some of you might even be newly postpartum, but we're gonna kind of talk about that postpartum period. All right. I saw this quote in this book and I thought it was I really identified with it. It says, people tell you how tired you'll be, but they don't tell you that you'll be able to survive without much sleep because the simple act of looking at your baby is stirring, gratifying, and energizing. So these are my two babies. They were in the NICU for a little while, so I was doing a little skin to skin with them. And I could definitely identify with the lack of sleep, but you really do have a lot of grace to take care of those little babies. So don't be afraid. You're gonna love looking at them and spending time with them. And it's a love you'll have never known before. All right. So the golden hour. So you may have heard about that first hour after delivery. Sometimes it's called the golden hour. And it's talking about that skin to skin contact with your baby. Most babies are the most alert that first hour. Some benefits of skin to skin, it helps prevent postpartum hemorrhage, which is great. You don't want that. It helps the flow of hormones that aid attachment and breastfeeding. And just so you know, the nurses can check your baby and do their assessment with you having the baby on you. As long as everything's okay with the baby, you don't need to give them to the nurse to weigh. They can wait to do all of those things. And the nurses are really great about that here at Good Shepherd. So they're not going to try to take the baby. You can have the baby with you skin to skin that first hour uninterrupted. So even dads can do skin to skin. This is my husband with one of our babies in the NICU. He's not going to watch this, so I posted it. But he did skin to skin, and it's crazy that the dad also can do skin to skin, and it helps the baby's temperature, regulate the baby's temperature, and it really helps aid just bonding with the baby, and it even calms your infant. So only you and dad can do that. So I thought it's really neat. The fourth stage of labor, we talked a little bit about this last week. So the fourth stage is that immediate right after delivery and postpartum. So this was me right after the birth of my very first baby. This is my baby boy, and then my girl came after that. So the fourth stage is when your body automatically right away starts beginning to adjust to kind of that new non-pregnant state. Your body in reverse. So see, here are some of the physical changes that you're going to experience right away, but then as time goes on as well during that postpartum period, which we consider mostly that first 6 weeks, although you're postpartum longer than that. But the first 6 weeks is the real postpartum phase, where you're going to have the lochia is the bleeding. Immediately afterwards, it's going to be kind of like run like a period, and then it's going to gradually over the weeks get lighter and lighter. The milk will come in. Well, we get this question a lot, usually like day 3 or day 5 after you have the baby. Before that is going to be your colostrum, which is full of a lot of immunity, and it's called liquid gold because it's kind of that yellowish color, but it's very thick and kind of sticky, but your baby does not need a lot, so don't worry about your milk not coming in right away. You will be able to feed your baby. Your baby's stomach is very small. It does not need a lot, and that colostrum will fill your baby up. Your uterus, it takes about 6 weeks for your uterus to go back to kind of that pre-pregnant size. You will have some cramping most of the time, and in every subsequent pregnancy, the cramping will most of the time get worse. So for sex, you can resume sex after 6 weeks as long as your provider says it's okay. Before that, we say pelvic rest, where no intercourse, no tampons, nothing inside the vagina. Exercise, we always recommend Kegel and pelvic floor exercises, and then you can start and nothing strenuous until after that 6 weeks, but before then you can do walking. Do you guys want to do anything? Okay, all right. So some physical discomforts and suggestions. So for the contractions, we usually give you a prescription for Motrin, 600 or 800 milligram tablets that you can have. You can also use a heating pad. It's going to be a lot like your period cramps, so things that would help with that. Difficulty urinating, you can use a warm water bottle or even use the soak in a warm tub. Some people have some burning afterwards. Usually that lasts less than a day, but if you have a little tear around where your urethra is at, it can last a little bit longer. We would want to know if that was something that continued. Fear of the first bowel movement. Usually this is after the C-section, but or after you have a vaginal delivery and have a tear. We do recommend stool softeners just to help soften that stool so you're not straining. And then eating, fiber-rich foods, drinking a lot of water, all of those things are going to help. Just like when you were pregnant and constipated, it's going to be kind of the same thing. Hemorrhoids, a lot of women have hemorrhoids just due to the pressure of the baby and then from pushing. So things you can use for that would be Tux pads or something equivalent to that every time you wipe. You can get the cream as well, and you can even get that here postpartum. We can prescribe that for you. And again, just helping it not strain by using those stool softeners will help as well. Pain from the vaginal repair. A lot of times you go just fine with just the Motrin, and you use a warm water bottle to help kind of clean that area off. We have some numbing spray as well postpartum, so if you don't have it, we can get that for you. You can kind of spray that area that's causing you some discomfort. Warm baths again is another one. And then if you needed something more than Motrin, that's something also that we could talk with you about as your provider. We can give you something else if it was something, really bad tear needed more than Motrin. Breast discomforts. So when that milk starts to come in, you might experience some engorgement. You can use some hot compresses and then even some cold compresses in between breastfeeding. Nursing. If you decide not to nurse, we can talk to you about some things that you can help to make your milk kind of go away. Sometimes wearing tight sports bras and cabbage leaves inside the bras help, but just let us know what your plans are so that we can help kind of prepare you for that and talk you through what that might look like. And then things that we would want to know about, heavy bleeding. So we consider heavy bleeding soaking one of those thick pads that you'll see postpartum in every hour, or passing large blood clots bigger than a golf ball. Having a fever greater than 100.4, having foul-smelling discharge or any sign of infection, thoughts of harming yourself or your baby, anything that you feel like is out of the ordinary, we would always want to hear from you. You don't have to wait till your 3-week postpartum visit. Most of the time we see you either at 3 or 6 weeks. If you have a C-section, a lot of times we want to see you back sooner than that, usually 1 to 2 weeks to check your incision. If you have any problems during the pregnancy, like hypertension, or high blood pressure, we might see you back sooner to just at least check your blood pressure, make sure all of that is okay. Other things would be like a headache, severe headache, dizziness, seeing spots, kind of any kind of visual problem, and pain in your calves, or any kind of sign of a blood clot, like shortness of breath, anything out of the ordinary we want to talk to you about, and we want to hear from you. And we can also go over that with your discharge instructions as well postpartum. We're not just going to send you out the door. We are going to go over those instructions with you. And if you have any questions, that would be a great time to ask them as well.
I want to add a few things. So I'm going to go back to the list. Difficulty urinating. One of the things that really, really helps if you're having problems urinating is to put some peppermint oil in the bath, in the toilet bowl. It actually relaxes the urethra and makes it easier to urinate, so you can try that. Hemorrhoids, one of the most important things to remember about those is not to use dry toilet tissue on them. It irritates them even more. It takes them longer to resolve. So always use wet wipes. Get some flushable wet wipes. And Tux pads are really good for those, but they're just little pads that are soaked in witch hazel. You can buy a bottle of witch hazel and you can make those yourself, or you can soak in a tub with a whole bottle of witch hazel like every day for 3 or 4 days, and it will help a whole lot. The other thing about breast discomfort is that we have lactation consultants here in the hospital. They're going to see you when you're here, but you can make an appointment with them even after you're discharged, and they'll be glad to help you. So those are just some things that I wanted to add.
Postpartum depression. So 1 in 7 women suffer from postpartum depression. This picture was actually kind of comical, but it's true. It's the mom who's tired. You have the baby crying. She's pumping. She's doing a million things, and she's sleep deprived. And this is something that really happens. So we definitely want to touch on this today. So you may have heard of something called postpartum blues, and that is different than postpartum depression. I just want to touch on the difference between these three. So postpartum blues, this is something you're going to experience that first week to 10 days postpartum. And most women feel a little bit emotional, maybe some moodiness, some crying, sometimes some sadness. It's transient, as in it kind of comes and goes. They also experience a lot of excitement. So there's happy emotions during that time too. And that is, most women will experience that. Postpartum depression is when the postpartum blues last longer than that. And it's a lot. It's not transient. It doesn't come and go. There's more bad feelings than good feelings. There's this desire where you don't even want to do anything. You are sad all the time. You're crying all the time. That's not normal. That's not postpartum blues. And those are things that you want to bring up with your provider at that 3-week visit. And if it's really serious, we want to hear from you before that for sure. And then postpartum psychosis is actually pretty rare. It's when the woman maybe starts hearing noises, starts hearing voices. Sometimes they feel like they need to protect their baby. In a way that is, they want to harm their baby, or they want to harm themselves. Those are things that are definitely we want to know about. Any kind of thoughts that you feel like are inappropriate. There's nothing you can't tell us. We want to hear it. There's nothing you can't say to us that we're not going to judge you. We want to know what your thoughts are. Even if your thoughts are to harm your baby, we want to know that, and we want to get you help. And there's no shame in any of those thoughts. We're here to help you.
There's another thing that goes along with postpartum recovery too in the mental health department, and that's OCD, postpartum OCD. Sometimes women will get what they call intrusive thinking, and they'll get really, really obsessive about their babies. And this kind of problem, women typically do not act on, but they go out of their way. They're very obsessive about doing anything that they can to prevent whatever they're thinking from happening. Like, for instance, if a lady thinks that she could drop her baby, she will go out of the way to do things to prevent her from ever possibly from dropping her baby, to the point to where she could harm herself or something like that. So that's another thing that we don't talk about a lot, but it's very real. So if you start having intrusive thinking, things that you're thinking that you're going to do to your baby and you shouldn't do them, or things that could happen to you or your baby, you need to tell us that too, so that we can help you. It's a type of anxiety.
So we did touch on this, but just again, there's a difference between postpartum depression and baby blues. So 70-80% of women experience baby blues, just like we talked about. Feelings of worry, crying, sadness, sleep problems, mood swings, and fatigue. Hormonal factors, physical discomforts, fatigue, birth experience, and unexpected outcomes. So all of these things can really play a factor in, maybe you didn't have the birth experience you wanted. Maybe there was something traumatizing. Maybe your baby went to the NICU. With COVID, your family can't come and visit. There are a lot of factors right now, especially with when you go home, some family might not be able to come and see you. I know our family's all from out of town. There's a lot of people who couldn't fly in, and it was very isolating at times not to be able to have family here after you have newborn babies. So all of these things can play a role in postpartum depression. So again, when these baby blues kind of last longer than a month, which I would even say probably shorter than that, but if definitely after a month, we need to know about that. We want to talk about that with you. And if it's really disrupting your daily life. Up to 50% of women with postpartum depression are never detected. And a lot of times women don't want to talk about postpartum depression. I know I've had several women, younger women, who thought if they told me they were postpartum depressed that they would have their babies taken away. I'm not sure where they heard that from. I thought that was crazy, but you will not have your baby taken away if you're postpartum depressed. Obviously, if you tell me you want to harm your baby, there's going to be no judgment. But as your provider, I'm going to have to make sure your baby's safe. So, of course, those kinds of things we're going to have to get you the help that you need, but you are not going to get your baby taken away. And even I think at that 3-week visit, maybe you think you're supposed to be doing well, and you think if you say you're depressed that means somehow you're not, bonding with your baby. I recently had a woman last week who we went through her whole 3-week visit, and I said, okay, any other questions? And she started to cry, and she said, when does this get easier? And I could tell she just was going to leave, and she wasn't going to say what was going on with her. But as your providers, we're always trying to give you that space to be able to communicate with us. And she was just tired. She was a new mom, and she was tired, and she was worried that her baby wasn't getting enough, milk. And we went through all of that with her. If you'll let us know what your fears are and what's going on in your mind, we can talk through some of those things with you. And the warning symptoms we kind of talked about. So like what Selena said, those intrusive thinking, that obsessive, compulsive thinking, any thoughts of harming yourself or your baby, those things that we need to know about right away. And really, you should be going to the ER if you're having those kinds of thoughts. And some women require to go on medication postpartum, and that's okay. And it's okay to be on medication. And some women, if we put you on it, usually we want you to stay on it for probably a year to make sure that that postpartum time is covered, because it takes a while for your hormones to get back to normal. And we want you to be able to have that time to be okay and to enjoy your newborn.
So there are some things that you can do to try to help prevent postpartum depression. You can begin to do those as soon as you have your baby and you get home. The first thing is that you need to make sure that you are trying to get some long stretches of sleep. You're going to have to enlist someone to help you, because new babies wake up frequently and need your attention. But you can get someone to help you so that you can get some longer periods of sleep, especially when you can kind of figure out when your baby's going to get a longer jag of sleep. So your goal is to eventually try to get at least 6 hours of uninterrupted sleep. That's very difficult at the very beginning, but you have to try to work your way towards that. And like I said, enlist people to help. The second thing is, just because you've had your baby doesn't mean you quit drinking your water. You still need to drink a lot of water, a lot of fluids, because especially if you're producing milk. But one of the two most important factors with postpartum depression are dehydration and sleep deprivation. Those are the two leading factors of postpartum depression. The other thing is that you can eat lots of really low-fat foods. If you eat a high-fat diet, you're more likely to have problems with postpartum depression. So one of the best things to eat is turkey, and not processed turkey, but real turkey. Turkey has L-tyrosine and L-taurine in it, which are both antidepressant enzymes, and they can really help a lot. The other thing is to make sure you have open communication, because people around you may not realize or understand that you need some extra help. And people with postpartum depression tend to kind of retreat, and things can get really bad before people take notice. So really, really communicate with everybody about what's going on with you. The other thing about postpartum depression is dads can have it too. If you have it, your significant other is more likely to have it. And actually, it's not as well documented, but probably 70% of dads have postpartum depression. It just looks like a whole different picture. They tend to go off by themselves and be really quiet and start doing other things to distract them. So you have to watch out for each other, your teamwork, and you need to talk to somebody else in your family or a friend to kind of keep an eye on both of you, so that they can kind of point out if they think that you need some extra help too.
And I think one of the best advice I got was, if somebody asks if they can help you, just say yes. I'm not somebody who likes to ask for help, and you might not even know what your needs are, but if anybody offers to bring food or pick up this or come over and do bottles, it was hard for me to say yes, because I didn't really necessarily want a bunch of people in my house, but I said yes every time. And they brought over food, and they brought bottles, and they did laundry, and just accept the help, and then ask for help if you need it, for sure, and talk to your partner. Maybe that's your mom, who's kind of your main partner helping you with the baby. Talk with her and say, this is what I need today. I need to take a nap, and I'd like to talk for 30 minutes on the phone with my friend. Like, that's what I need today. Like my husband and I will go back and forth. Okay, I would really like to do X today. Could you watch the kids today while I do that? And he would say, okay, I really want to be able to do this. And we try to meet each other's needs that way. And it doesn't always work out, but that's what you need. You need to be able to communicate with your partner. Okay, so these are my little pumpkins. And now it's time for any questions if you have them. Give a few minutes. And next week we're going to be doing newborn, kind of that first 24-hour period. After your newborn, what are you looking for? We're going to talk about circumcision, pediatrician. So that will be our last in this series of classes next week, next Tuesday, same time, 4:30.
And remember that if you think of a question later, you're welcome to call our clinic and ask that question. One of us can call you back. We don't mind at all. If you are one of our patients, well, then you know that you have access to us during your visits. If you're not one of our patients, we're still really available to answer your questions for you and help you any way that we can.
All right. We don't see any questions, so we're going to go ahead and wrap up. Again, we'll be back next week at 4:30 talking about the newborn. We also did another postpartum series back a few months ago. We did postpartum as well, and we talked about other things. We met with some of the postpartum nurses, so go back and check out that video as well, and then we'll touch on the newborn, some new things next week.
There's also, if you aren't already one of our followers, we have our own Facebook page. It's CHRISTUS Trinity Clinic Midwifery Group, and we're doing a giveaway this week. So if you haven't gone on to take a look at the things that we post every day, actually, then go take a look and find the giveaway post so that you can participate in that. We'd love to have you.
Yep.
Anyway, we don't see any questions right now. If you have some, call. Otherwise, we're going to sign off, and we'll see you next week.
All right. Bye, guys.